Hey Present Unified, I'm Desiree from Pinnacle Training Systems, and we're back with another Fitness Corner video. This month's topic is going to be on the epidemiology of back pain in the world, as well as taking a look at preventative back strengthening exercises and stretches to help loosen up your back. The goal of this video is to provide you with the proper information when it comes to prevalence of back injuries and why it is so important to maintain back and spinal health through both strengthening and stretching exercises. This is important for anybody, especially because most of us sit down all day, we're looking at computer screens, we're looking at our phones, and we don't realize that we have poor back postures. So this video is going to take a look and explain some different exercises to help strengthen your back. Back pain is a widespread disease in the adult population. Some studies have shown that up to 23% of the world's adults suffer from chronic low back pain. This population has also shown a one-year recurrence rate of about 24 to 80% more likely to still have the same issue a year later. So this means that these people who had the chronic back pain 1 year, fast forward a year later, they're still having the same issue and it's not getting any better. It's also estimated that 60 to 80% of adults in the Western countries deal with lower back pain. And because almost every movement your body makes engages your back in some way or form, this kind of pain can really put a damper on your everyday activities. There are 5 different types of lower back pain. So one's going to be mechanical, degenerative, inflammatory, oncologic, and infectious. Mechanical back pain is most commonly due to injury to the spine, intervertebral disc, or soft tissues. Fractures such as spondylolisthesis can be both an acute or chronic process. Lumbago often is labeled as an acute back pain or a strain to either the quadratus lumborum muscle or the paraspinal muscle. Disc herniation is a common type of traumatic back pain. Pregnancy is also a mechanical cause of back pain. Degenerative back pain is often caused by as you get older. Main type of back pain for this is going to be osteoarthritis of the spine, which can include facet joint osteoarthritis, sacroiliac joint osteoarthritis, spinal stenosis, and degenerative disc disease. Furthermore, osteoporotic compression fractures are also a degenerative process. So next is going to be inflammatory back pain. This can be caused by many different methods, but one of the most common forms to cause inflammation in the back is going to be if you lift something heavy or if you twist your back funny. It can cause your muscles to become inflamed. Typically, this is an acute syndrome process, meaning that it doesn't last very long, but overuse of it can cause more chronic inflammation. Then we have oncologic. This is typically caused by lytic lesions to the spine, cancers of the marrow, or compressive nerve phenomenon from adjacent space occupying lesions, often presenting as a pathological fracture. Finally, we have infectious of the spine, disc, or epidural abscesses or muscles of soft tissues processes can all lead to different types of back pain. Common methods of treatment and prevention for back pain. When it comes to strengthening and preventing injury to the lower back, it is essential you strengthen the core of your body. This doesn't just mean your abs or obliques, but also the muscles that run along your mid and lower back, which are also essential in stabilizing the torso. Now let's take a look at the muscles in your back. So we're going to start with your latissimus dorsi. This is also known as your lats, which are in the area below your armpits, down the sides of your back. Your rhomboids, which are in the mid-upper back area, your traps, which run from your neck to the mid-back, and your erector spinae, a group of muscles that run along your spine in the lower back area. There are many different types of exercises that range from moderate to intense workouts that can strengthen your back and your core muscles, but if those are not always an option, there are some low-impact activities that can help strengthen your back muscles, such as Pilates, yoga, walking, swimming, or even cycling. So what are some health benefits for your lower back? Doing exercises to strengthen the lower back can help alleviate and prevent lower back pain. It can also strengthen your core, leg, and arm muscles. Exercise can also increase blood flow to the lower back area, which may reduce stiffness and speed up the healing process. Having a good stretch and strengthening program for the back and spine are both essential for good mobility and stability in the body. So what's the main takeaway of this video? Take charge of your health. Make sure that you take care of your back and spine health by being proactive and staying on top of your health. Also, if you have any serious past or present injury, spine or back muscles, make sure you consult your physician to make the best decision on what type of activities are best for you. Jordan now is going to take you through some stretches and do some different exercises with you to help strengthen your back.
All right, now that you know that back pain is prevalent in the United States and in the whole world, now we're going to go over some ways you can stretch and strengthen those back muscles to reduce pain or to reduce the risk of getting back pain. So, we have a couple muscles in our back. I'll just name the major ones. In the neck, You feel your neck right here. It's right in the back, right between your shoulder blade and then the neck. If you bring your shoulder up to your ear, you'll feel it right here. That right there is your traps. Traps are important for neck support and upper back support. We have the latissimus dorsi, which goes from the upper arm, goes down the back. You feel in the rib, especially if you push your arm downwards, you should feel it flex right here. It's like a wing. You have the rhomboids, which when you pull your back, they clamp in the back, upper back. You have your erector spinae that goes from the back of the skull all the way down to your lumbar vertebrae, which is right above your butt. And those are some of the major back muscles that you have. Now, what we'll do is I'll name a couple of light activities you can do that's not like resistance training or stretching that are really good to build lower back. These will be yoga, Pilates, swimming, and walking. These are all very low impact exercises that shouldn't stress your back that much and are still aerobic enough to strengthen your back and your core muscles. The reason I say core muscles is because if you didn't know it or not, the biggest way to reduce lower back pain, if it's something more like a muscle strain or something, is to build your core muscles. And core doesn't just mean the front of your body. Core means your stomach muscles and also the band all the way around. So it'd be all the muscles going from your core to your back and even your glutes. Your glutes are really big for balance and support the lower back. So if you have strong glutes, you're less likely to have lower back pain because they'll be able to carry more of the weight of your body. All right, so now I'm gonna go into some stretching. All right, so we're gonna start with this simple exercise. You're gonna keep your toes pointing forward, knees pointing forward. You're gonna bring your arms out, you're gonna twist side to side. You want your chest to go to each side. You do not want your feet to move at all. You'll do this for about 30 seconds, 3 times. What this does is it works your whole back in rotation. Something you can do on a chair at work as well to warm up your back if you feel it's a little tight. All right, let's get the next exercise. All right, so this stretch is very familiar. It's something that a lot of people did in PE when they were younger, just to check trunk flexibility. What we're gonna do first, or what we're gonna do as a warm up for the back, is called a cobra stretch. Cobra stretch is you're gonna lay on your stomach. You're gonna have your arms right here. If you can't, lift your trunk up. And you're gonna push your back up. Kind of simulating a snake coming up like a cobra. You'll do this. You go down. Hold it for 5 seconds at the top. 1, 2, 3, 4, 5. Down again. You'll repeat this 10 times. This is just getting that back loosened up, getting those back muscles contracted, getting them awoke a little bit. And that's the cobra stretch. All right, so now we're gonna do more of a Pilates yoga stretch. It really activates the back, also keeps your core stabilized. What we're going to do is we'll get on all fours, including your knees. You'll keep your back in a neutral position. Don't have it curved or anything like that. You wanna have it in a neutral position. What you'll do is you'll breathe in, have your back arched like a cat. Breathe out, return it to base, and that'll be a cow. This is called the cat-cow stretch. Cat, cow, cat, cow, cat, cow. And that'll be the cat-cow stretch. All right, so we're gonna do a similar position to the cat-cow stretch, but what this is gonna be is the bird-dog stretch. So what you're gonna be doing is you're gonna be down on all four again, like you're a dog this time. You're gonna extend your right hand and your left leg, alternating sides. Reach out, bring it back, and switch. You repeat this 5 times on each side for 10 reps. You'll feel glute activation, lower back activations with shoulder. Then after that, you stop. You repeat this 3 to 4 times, and that will be your set for your stretching and getting that little active stretch in the lower back and glutes, or glute flexion. So what we're gonna do now is something not on all fours, but on our back flat. This is gonna be a lot easier for a lot of people. Some people might not have the mobility for it, but you can just try your best. It's a pretty easy one. You'll lay flat on your back. You'll bring up your knee, and you'll pull your knee towards your chest. You bring it down, switch. You'll do this 5 times each side, again. What this does, it stretches out the lower back just a little bit, stretches out the glute as well, and you repeat that 3 to 4 sets, 5 reps each side. And that'll be it for the alternating knee hugs. Now we'll conclude our stretch warm-ups. All right, now that we did our stretch warm-ups for our back, now we're going to do our exercises specifically to strengthen the back. So the first thing we're going to do, it's similar. You see a lot of people do this in the gym. It is a glute workout, but it's also good at building stability in the core section, which is essential for the lower back. What you want to do is get down. You can have 2 options. You can have your hands on your chest, bring your glutes up, squeeze. These are glute bridges. Or you can have your hands on your hips, bring your hips up to feel your hips go fully straight and go down. Purpose is at the top, your core tightens, and your glutes at the bottom, it relaxes. It also works the lower back. Continue. So you're gonna do this 10 to 12 reps for 3 sets. And then we'll move on to the next thing. So the next exercise, since we're already down here, we'll flip over. It'll be Superman's. So Superman's is in a similar position as the Cobras I explained earlier. But instead, your hands are out like you're flying and your feet are out. What you're going to do is bring your hands and feet up, down, and feet up, down. You're working your spinal extensors. You repeat that 10 to 12 times. Okay, another great back and whole core section, which includes the lower back exercise, is the go-to for a lot of people, and it's pretty much the most common, one of the most common core exercises other than sit-ups. It's just a plank. What you're gonna do, have hips on the ground, elbows out, make sure your arms or your elbows are parallel to your shoulders. You're gonna bring your hips up. You don't want your butt up in the air, or you don't want it too low and sunk. You want it right even. What you're gonna do is really focus on keeping that core tight. I'd recommend doing this 3 sets for at least 30 seconds to start off, and then go up to a minute, or keep progressing from there once it becomes easy. All right, the next exercise we're gonna do is we can get back on the ground again. Hands out, hands on the hip, lying lateral leg lifts. So what you're gonna do is just bring your leg up, down, leg up, down. This really stresses the lower back right here. Also works the obliques. We'll flip over. You can either flip over this way or rotate, breakdancer style. Same thing on this side. You're gonna do this 10 times on each side for 3 to 5 sets. All right, the next exercise we have is what I call the lying lateral back rotation. What you're gonna do is bring your knees up, have your arms to the side, shoulder blades flat. What you're gonna do is bring your elbows this way, or not your elbows, but your knees this way, touch, knees this way, touch. The upper body should not be rotating, just the knees. What this does, it works the spinal rotators in the lower back. It really stresses them and makes them be stable. You're gonna do this 10 times, then you'll relax. The next exercise we have, which is also very easy, is if you can do a sit-up, what you'll do is you'll push forward, come up, push forward, come up, go to the knees. Don't come all the way up, that might hurt your lower back. What you do is you'll come up about right here, touch, here, touch, just enough for the elbow to touch the mid-thigh. If you can't go that high, if you don't have the flexion to do it, what you can also do is just reach your hands forward, slide them on the ground, and bring your shoulder blades up. 1, 2. That will still work the core and engage the core, but it won't require you to go up as far. This can be used for anybody. You'll do it 3 sets, 15 reps for this one, and that will be your spinal exercise or your spinal strengtheners.
All right, Fresno Unified, that's going to complete this month's Fitness Corner video on back and spine therapy. If you have any questions or need some more information on different types of programs, feel free to reach out to the contact provided at the end of this video. See you again next month.